Very much, Mark. Now, plans to reconfigure services at hospitals in East Sussex have been put forward by the NHS to the fury of campaigners. Managers want to concentrate emergency and high-risk orthopaedic and general surgery at the Conquest in Hastings, and stroke services would be concentrated at Eastbourne's District General.
Well, they argue the changes will improve the quality of care for patients, but campaigners, including the MP for Eastbourne, say the Trust has misled the public and that reducing services at either site will result in lives being lost. Claudia Sabasis reports.
Beryl Newson has a bad hip. She's been told she'll need surgery. If she ends up being considered high risk or treated as an emergency, she'll have to go from her home in Eastbourne to Hastings for the op.
Terrible journey. If you get stuck on the roads when it's rush hours or anything, it can take up to an hour. I rely on friends and family to come and see me, and it'd be much more difficult for them to visit. And my grandsons wouldn't be able to come because they haven't got transport.
But the NHS Trust says it's all about improving healthcare in East Sussex.
One of the primary benefits is to ensure that you see a senior doctor when you come into the hospital, so that they can start your treatment pathway and, if necessary, take you to theatre, for example in general surgery, so that you can have your operation in a timely fashion. That means you're on the path of getting better sooner, and it means that your length of stay in hospital will be reduced.
Eastbourne MP Stephen Lloyd says that more than 90% of consultants in the town disagree with the findings, and the Trust are just not listening.
They were the fastest growing town. They were united on this, though the business community, all the political parties, are completely joined at the hip in fighting for our hospital to have a long, successful future. They seem to be pushing this through. I don't understand it, it doesn't make sense, and it doesn't make sense for Eastbourne, and that I'm absolutely committed to fighting.
Over the past 2 years, Save the DGH and Hands Off Our Conquest have been campaigning together, as despite the benefits, they fear the price will be too high.
Conquest would become a centre of excellence for those things, which is brilliant. However, there's such a vast area of the population of East Sussex that need these core emergency services that we must stick out for them at both hospitals.
The campaigners say they will now continue their fight.
Well, today's developments are just the latest chapter in a long, drawn-out battle between campaigners and health managers over plans to reconfigure services at Hastings. In 2006, the East Sussex NHS Trust began a review of maternity services, including proposals to close the Eastbourne unit. 2 years later, that plan was scrapped following fierce local opposition. But there were further protests in Eastbourne in September, when the latest plans to centralise some services were put back on the table.
Any major reconfigurations need to have local doctors who are saying this is what we need for our area. There needs to be clear evidence, and there needs to be public involvement, and they need to increase patient choice. And we've said that we won't support any major changes unless they fulfil those 4 tests.
Well, Claudia Sabasis joins us live now from Hastings. And Claudia, if the campaign groups say people in both towns don't want these changes, why is the Trust pursuing them?
Well, because they insist that it is much better for patients. They say that you'll have access to specialist consultants 7 days a week, 365 days a year. There'll be none of that your consultant's got on holiday or it's the weekend so the specialist isn't in. They also said they'll be able to attract specialist consultants because they want to work in bigger units. But the campaign groups disagree, and they say this is the start of a slippery slope to downgrading both hospitals. Now, Stephen Lloyd will be hosting an open public meeting a week tomorrow at Eastbourne Town Hall to discuss this further.
OK, Claudia, thank you. So what happens now? Well, the final decision on the recommendations will be made by the Healthcare Commissioners, NHS Sussex, in a week's time. If agreed, the changes could come into force by the end of next year.
Now, coming up on the programme in a moment, who will pay to clean up the Thames Steel